I welcome you all in CUREGA SAMWAAD Dil Se Dil Tak. Today we are very honored and fortunate to have Dr. Reema Kashiva with us, who is HOD of Noble Hospital, Pune. Dr. Reema is one amongst very few who have treated maximum number of COVID patients in Pune. And today we will try to ask her and we will seek her advice on new variant. Dr. Reema, over to you.
Very warm good evening to all of you. As asked by Chiranjeevi, for me to speak about the new variant of COVID that is there presently in India. So what I would like to say is that yes, we are there amongst the third COVID wave in India. Unfortunately, which we had not expected actually, but सच्चाई ये है कि आज हम कोविड के थर्ड वेव के बीच में आ चुके हैं. The new variant which is there in this third wave is Omicron virus. However, I would like to emphasize that the Delta wave which was there in the previous wave hasn't still gone, and we are having mixed cases of Delta and Omicron, with Omicron leading over the Delta variant. But to our fortunate circumstances, the Delta variant is also representing not in as bad form as it was representing in the last wave. There are few things that we all should know about this virus as we have already entered in third wave. The first and the most important thing is the curiosity among general population about the Omicron. It is deadly, it is more mutating, or it is more communicable, what it is. So yes, the virus is really more communicable, which means कि एक से दूसरे को बहुत जल्दी बहुत फास्ट हो जाता है as compared to previous phase. But the positive thing with this virus is that this is not very fatal till now. All those cases that we are seeing now have been, most of them, in the mild forms. They are not needing much medications. Couple of them are not even needing antiviral drugs. They are getting all right in 5 to 7 days of time, only on OPD basis treatment. Most of them on OPD who are presenting with high fever and all are not even needing CT scan if intervened with antiviral drugs on time. Fortunately, now we have some good antiviral drugs that are intervening early, that if intervened early in the course of disease, prevents the progression of disease to moderate to severe form. So this is about the new variant presentation. The second most important thing that is now creating a stress in the mind of people is about the children. So children broadly between 15 to 18 years of age group, this is the most stressful period because they are unvaccinated, and these children are actually also coming in the mild form in OPD, barring few who are obese, who have some genetic disorders, or who have some associated comorbid diseases, like the normal adult population, who are also getting serious if unvaccinated, or if have morbid obesity or any other comorbid condition. So 15 to 18 age group also is presently coming in the mild form only. Less than 13 years of children are also getting all right in the pediatric OPD by simple flu-like treatment only. The bad part of this virus is that we are now getting reinfection a lot. Those people who have been infected in 2020 and 2021 are also getting infected. They are self-testing or testing outside and coming with positive reports. But again, these are presenting in mild forms only and are getting treated with simple antivirals or symptomatic management only on OPD basis. So this is about the clinical presentation of the new Omicron virus in the third wave and the Delta virus which was there presenting in the milder form. Now, there have been genomic analysis of the samples from our hospital, and the data has suggested that there is a mixed combination of Delta and Omicron. However, even the Delta virus presentation is in the mild form only. तो ये है कुछ ओमिक्रॉन के बारे में अबाउट द क्लिनिकल प्रेजेंटेशन.
So thank you very much, Dr. Reema, for brief information about new variant. Now just we like to know that if as a doctor you have to give some message to the society, what message you will give to society?
Okay. Because Omicron is now coming in a mild form, most of the people are thinking that they need not to be tested and they need not to be treated. The disease is going to get treated like influenza. This is not the correct thing. You need to get yourself tested. You need to go to the nearest flow OPD to get the treatment. It's because you may have the disease in the mild form, but when you go out, you may spread the disease to someone who can have it in a very serious form. Also, we are now in the beginning of third wave only. We don't know what is going to happen when it peaks, how it peaks, and again when the virus mutates, what turn it can take. So the disease which is mild now can at any moment of time can become severe and can become deadly. So please, all of you are having symptoms, test yourself and get treated yourself. Another message that I would like to give is, please do not self-medicate. Please do not come into controversies of not taking antivirals. Your doctor is the right person to decide whether you need antiviral drugs or not. So please believe your doctors and go ahead with the treatment that they prescribe to you. Follow the quarantine period if you have symptoms. Do not move out. Prevent the spread and help in containment of the disease. People are actually now wanting to have easy treatment through online consultancy, which is really good both for patients and us. It saves time and rush in hospital. But that is not a very good way of checkup because we are not physically testing the patient's pulse, blood pressure, we do not auscultate chest, and we do not see other parameters. So most of the patients that come in our OPD after 5 to 7 days of online treatment, they are complicated because they were not being examined. And so I would like to say, try not to have more online consultation, visit your nearest room OPD. Take proper treatment, that's the only way to prevent complication. Last but not the least, please, if you are not vaccinated, vaccinate yourself with second dose, vaccinate yourself with booster dose. We still get patients in OPD who are yet not being vaccinated with even 1 doses, and it is this population of unvaccinated people who are actually likely to get the deadly form of the disease. Follow proper proper COVID appropriate behaviors like mask, sanitization and social distancing. Thank you.
Thank you very much, doctor, for your all valuable inputs, and I hope in future also will invite you to talk on CUREGA SAMWAAD on some other topics which may help to our society.
Sure.
Thank you very much, Dr. Reema.
Thank you so much.